Now our special focus on the show this evening. Well, a key study, in fact, has revealed that the Prime Minister's Swachhta Abhiyan, or the Swachhta mission, could have averted 60 to 70,000 infant deaths annually. Now, that's really a landmark study, or a landmark finding, perhaps, that this global study has concluded. In fact, researchers from the International Food Policy Research Institute in the US studied data from nationally representative surveys across 35 states and union territories from 2000 to 2020. So the point really here is that the Swachhta mission could perhaps have ushered in a real behavioral change, and the impact is real, given the fact that 60 to 70,000 lives, infant lives, as per this study, could have been saved as a fallout or as an impact of the Swachhta Abhiyan. What does it really mean? What is the way forward? The Prime Minister says it's great to see that India is leading the way. Well, joining me on the show this evening, I'm being joined by Sunila Garg, the chairperson of the Program Advisory Committee on National Institute of Health and Family Welfare, also a renowned doctor, an articulate voice on infant mortality. Also, Dr. Zakaria Abbas, a public health expert, is also with us. Thanks very much both for being with us. Dr. Sunila Garg, going across to you first, break it down for us. What really is the relationship between toilet access and infant mortality?
See, basically, one has to remember that under Swachh Bharat campaign or mission, we have constructed 117 million toilets. That means children will be using the toilets. There will be behavior change, and families will also be using toilets. So accordingly, the infections, which we call it as fecal-oral infections, will be, much more less. So more toilets you construct, there will be lesser number of children who will be suffering from diarrhea, gastrointestinal diseases and all that. So accordingly, infant mortality, that means death of the children under 1 year, is going to be low. So this is in fact a landmark study which has brought out that behavior change communication in form of using the toilets under Swachh Bharat mission, with the help of change in behavior change communication and your toilet habits. That makes a very important, it's a game changer, I will say, in terms of reducing infant mortality. And I feel that this kind of studies have got to be publicized more and more. And Prime Minister himself has lauded this campaign himself.
Right.
Thank you.
In fact, I would say that this is, of course, one of the Prime Minister's most successful campaigns, given the fact that it's got real pervasive change on the ground. But Dr. Abbas, what about sustainability? Because when you travel to the interior areas of our country, we see that while, of course, toilets have been constructed, there is some concern about sustainability. How sustainable is that toilet access that we talk about that will, subsequently, in a sense, usher in that behavioral change that is so important to make it, to sort of make our cities and our villages really open defecation free?
Well, as a proud citizen of India, it is a moment to celebrate. When we talk about change, this is change in action. Well, every citizen has a right to live just like you and me. Swachh Bharat Abhiyan, it's different from other sanitation programs is because of the public support in this campaign. When it was launched in the year 2014, people were very excited across party lines. When we talk about the progress of the nation, we should support what the government is doing. Like Madam has rightly said, this is a different campaign because it involved the public, because it had awareness. We told the people what are the advantages of defecating safely. The information, education, and communication, the three broader perspective, how the government has reached to the people is hats off. And I think the recent study, what you said, studied across different 35 states and 640 districts, it has interesting numbers. Like you said, India has reached the Sustainable Developmental Goals 6.2 health target way behind the target, way 11 years behind the target. This is a moment to celebrate. This is just the beginning. Right now, 60% of the districts have own toilets. Well, we have to work towards that 100% mark. And yes, sustainability is the solution, where last 14 years, there has been a massive development in people's mindset. And this study clearly shows the impact of investment, large-scale investment in sanitation and infant mortality rate, which is inversely proportional.
Right. In fact,
And
that's
I think
an
other
interesting point
countries,
you're making, that the scale of the impact, perhaps that's really interesting to look at, because if you're talking about 60,000 to 70,000 infant deaths annually, that's real change. But Dr. Sneela Garg, what are the challenges ahead when we look at infant mortality, particularly as a doctor yourself? What are some of the challenges? You know, we have really transformed when it comes to, you know, basic fundamental diseases like, say, malnutrition and, you know, Kala Azar, all those diseases that, you know, that were really rampant. We've come a long way. But what are the challenges going forward when it comes to infant mortality?
If I could hear you correctly, I will say that basically you asked me that what is the impact of this whole study, and
And the
secondly,
challenges ahead, the
what-
challenges when it comes to infant mortality.
yeah, ultimately, when we talk of, overall also in India, we have made, lot of progress in terms of reduction in infant mortality. Number one. Number two is when we talk of challenges, because anything which has got to deal with the behavior change, it has got lot of challenge per se, but we are looking at the return on investment. If we construct one toilet and we are, we have constructed almost, 117 million toilets, and we have to see that overall, if we are able to reduce not only, infant mortality, but as a result of that, DALYs, what we call it as disability adjusted life years. That means not only the child is sick, but also, the family members also spend time in taking care of these children, and plus, it will also reduce out of pocket expenditure. But as of now, what I could get is that, from your question, challenges still continue to remain, because information, education and communication has to be continuous, and anything which has got to deal with behavior change has got to be sustainable and over a period of time, so that, it becomes a part of habit. Because when I visited Rajasthan, and in a very good family, they had a toilet, but still they were, going out. So I feel that it is very important to, bring into the minds of people the benefits of using the toilets,
Sure.
which are constructed for women, children, and for families as a whole.
In fact, Dr. Abbas, come in on this point, because the whole idea of accessibility really hinges also on inclusion. You know, access to toilets across class, across castes, across gender. You know, gender inclusion as well, given the fact that we still really have a long way to go when it comes to toilets for transgenders, for example. That's a different issue altogether. But how do we ensure more inclusion when it comes to accessibility to toilets in public health?
I think this is the first criteria of achieving a healthy nation. We boast about healthcare. Other countries boast about healthcare, but we don't realize that these are the first primary criteria to achieve a healthy nation. Well, we need to focus more on preventive health. When we talk about preventive health, especially after the COVID-19 pandemic, we need to realize that we somehow tend to ignore the 60% of the rural population of India. Yes, the accessibility has to be taken under consideration. Transgenders, males, females, they all need to be treated equally, and more work has to be done. This report is an encouragement for all of us. People who doubted the developmental process. Change begins from you and me when we work collectively. Now, after 10 years, we are seeing some interesting numbers. Now, we have to introspect, and we need to decide how can we create a change furthermore. Correct? So yes, accessibility is very important, and to achieve an affordable healthcare, we are talking about healthcare. If we prevent diseases is when we will achieve affordable and accessible healthcare. Yes, we have to make sure every person lives in dignity and has the same privileges as you and me.
Absolutely. I think that's a very important point to perhaps end the discussion on, that toilet access is a fundamental when it comes to dignity, or dignity of life, and it's a great move ahead, and a great impact of our Swachhta mission, that 60 to 70,000 lives as per this study were saved because of the Swachhta mission. Thanks both very much for being with us on the show this evening. And with that, it's a wrap from me. We'll take a short break now. On the other side, India Ascends with Gauri Trivedi.